I am here with Dr. Omid Naim. Omid, thank you so much for being here.
Yeah, thanks, Matthew. Glad to be here.
So we talked a little bit offline before this conversation, and I've been really looking forward to it. The first question I wanted to ask you is just about your approach to treating patients as a psychiatrist. I know that the work that you do is a little bit untraditional, and your approach doesn't necessarily fit into the traditional medical model. So, can you describe kind of what your approach and philosophy is, and maybe how it differs from the medical model of treating patients?
Yeah, sure. So, I did Western psychiatry. Went to top places for residency, adult and child, and I just really saw, that many things that were not really feeling inspiring about how to work with people. And I wound up doing more training in integrative medicine, and that took me down this path of understanding a more holistic approach to understanding the problem and also using natural remedies. Um, and so I was working with people more using these natural remedies and, food, lifestyle, teaching meditation, getting people to implement new self-care practices into their life. But there were kind of two big influences that really made me evolve what I do and develop the model that I have. One was seeing the abundant research in, what you call social determinants of health, or there's a lot of research on resilience factors, which is like studying people who don't get sick despite experiencing the same degree of trauma and stress and hardship in their lives. And at that point, I also, really saw that trauma is at the heart of so much of what's happening, even all the significant amounts of depression, anxiety, substance abuse, suicide, that what's underneath that is trauma. And then in terms of that resilience research and social determinants of health, starting to see that the people who still, despite experiencing significant amounts of trauma or stress in their lives, don't get sick, a lot of it has to do with community. A lot of it has to do the way we're living in this society, and the amount of disconnection. And so there was that, and then coming to also see that what I had learned about medication use and the chemical imbalance theory was not only not working to really lead people to lead better lives, but it also wasn't true. It wasn't accurate. That most mainstream institutions, the American Psychiatric Association, NIMH, these institutions are on record prior to the 1980s as having talked about depression, anxiety as short-lived, episodic for most people. Most people recovered for the rest of their lives.
Mm-hmm.
When you ask me, how do I work? I think that it's seeing the whole person, taking everything into account. But the thing that really excites me is, the first thing I say to people when I sit down, I say, if you're willing to look at everything, I'm pretty confident that I can help you get completely better. And it's this idea of getting completely better, not that you won't have, more issues come up, but it's like sitting with someone with a broken leg, that most of the time, what's going on is trauma, which is like a broken bone or a skin wound, that there's a break in some way, but we have this capacity to heal if we support ourselves with the proper conditions. And it's sitting with someone at the beginning and saying, if you're willing to look at everything and do your part in healing and growing and making changes, that's what we shoot for, is recovery, and really believing in that. So it's empowering people to build the things they need to heal naturally and completely. So, I use remedies. I use 98% of the time, I use natural remedies. I don't use medication. But even still, I look at them the same. They're things that we're using to support and facilitate the person's own natural healing, just like you would if you had a broken bone. The cast, the pain medications, that's not where the healing is happening. Those are things that are supporting the healing process.
Mm-hmm. I love that question that you pose in the beginning of treatment with someone, or really the proposition, which is, are you willing to look at everything? And I'm curious how patients respond to that, and if they know what you mean, or do they have questions about that?
Yeah. As an integrative doctor, I would think that other people would think that, you see people that are more slanted towards holistic medicine, natural remedies, aromatherapy, thing like that. People that are, their tendency is to work that way. But I predominantly work with people who everything else has failed. And so I think there's a buy-in because there's a readiness. They're in it's like, I've been on medication for 10, 15 years. Now my child is being told that they have to go on medication, and I feel like there's got to be a different way. Or I've been on medicine and therapies for years, but I keep relapsing after, short-lived periods of benefit. So there's a readiness, I think, in our website and my reputation. I think people walking in the door, but still, I think that's a moment of making a contract with somebody. So I think the statement creates a contract. It's like, we're going to agree at the beginning. And that's a positive response I get, because I believe in empowerment. I think that's our natural state, which is that we have to take care of ourselves. We have to earn our health. We have to work for our health. That's a majority. That's what our biology has evolved to do, is to like work for health. And we predominantly work for health in relationships. Like that's like a pack of wolves, or any other group animal that we're mammals, and we work in support of each other to generate health, to survive. And we take that for granted because we live such lives of abundance. But that's like, I think what we get excited about still is when we're experiencing ourselves to be a part of something, that we're going to accomplish something together. So that's what I feel like that moment is. And it is like a real gesture of like community that I make with people. It's like, I like seeing people get better. I think that's great. I think that's awesome. That's what excites me. So when I say that to somebody, I also really mean it. Like, I'm going to be excited to kind of go all the way with you. I'll give it my all if you give it your all. And I think it's inspiring to have that goal to get completely better. Like, we should be getting completely better at the end. And what we do, it's a little bit more about like what's unique is, I also didn't like going, and I didn't like the way psychiatrists had come to just be doctors who take 10 minutes, maybe 15, do symptom checklists, and then tell you, here's a medicine for those symptoms. That's also like a historical new thing that we take for granted, like that it was up until the 80s, you had to have more of a formulation. So what we do at Hope, our clinic, is we provide this complete assessment, because I also didn't like people go to therapists, or even I went to therapists, and this experience of like, what's going to happen, I'm going to come week to week trying to figure out what's going on. So we try and give people a complete roadmap of like all those parts that we said we're going to look at everything at the end, where we kind of provide an understanding, where's the childhood issues, what's the current lifestyle issues, how are, the treatments you're using playing a role in helping or not. And then when we look at it all together, what I love is the last thing I say is, I think you can get completely better. I do think you can get completely better.
Wow. Even just hearing you say that, I mean, offers a sense of hope in me, putting myself in the shoes of the patient and thinking about working in that type of context and relationship. I also get a sense of excitement. I mean, I think normally we go to our healthcare provider, our doctor, and that possibility is not even on the table, or at least it's not presented. Or we've had the experience that, I'm not going to get better because my provider doesn't care about my holistic health, just about treating this one specific symptom.
Yeah.
So you mentioned using kind of natural remedies with people, but this is also about working holistically with people with their trauma as well. Do you do that type of work with patients? I know you have a team of providers. Are there other people doing that work with you?
Yeah, yeah. No, we do. We're the basis of how we assess a case is, if there's a few levels to it, but one major pillar is understanding trauma, and understanding early childhood trauma is really setting the stage for what then happens for people chronically. And then it becomes about, the lifestyles we lead and how we have trouble connecting as a consequence of that early childhood trauma, which includes then ways in which we had to disconnect from our authentic self in order to fit in and cope, most often in families where the trauma was happening. So that's like the root of how we see the symptom development over a person's story, through a person's story. And then the other side of it is that more positive empowerment lens of like that trauma is part of life. It's part of what it is to be human. We're it's not that, I think we're advocates for a lens, and also the nonprofit that I founded is really trying to put forward a lens that like trauma and stress are at the root of most of the chronic health conditions that we're struggling with, but also for the trauma-informed movement to not become the new sickness model. I give this talk to people in the psychedelic community also. I think in a related way, like the trauma-informed movement and the psychedelic movement are highly, they're excited communities right now, because they're trying to change the way mental health is being delivered through the lens of their paradigm. And they're accurate, but just like the analysts were accurate and the behaviorists were accurate, and also the modern, biological psychiatry that started in the 80s, thinking that this is going to change the field, and they make major contributions. But I think the problem can be if they continue to go through this lens of a sickness model, that like viewing us as sick, deficient in some way, needing something outside to fix us because there's something wrong with us.
Mm-hmm. Can you say a little bit more about how that sickness model, whether it's, the trauma lens or the psychedelic lens, how that contrasts with more of an empowerment model and the model that you're operating with?
Yeah, I mean, it's like if you take an example of the broken bone, when you get a broken bone, you go to the doctor, and the doctor will say to you, like, yeah, there's a broken bone. There it is. There's the fracture, right? But there isn't this deeper message that there's something wrong with you. There is there's a tendency in our field to pathologize the individual, and that goes back to Freud. Is like that something happened to you, and then you go, the whole theme of like psychotherapy, where like you go in a room by yourself with another person and you keep it private and you share these intimate stories. Like there's something deeply meaningful about that, and many people benefited by that. But that construct itself, I think, creates this like of like, seeking for what's wrong with you. Like we all of medicine, all of Western medicine is based in pathology. We study sick people.
Mm-hmm.
And then so taking that all the way up to then the chemical imbalance theory that was born in the late 80s, early 90s, because of a confluence of historical factors that kind of produced this theory that has no solid conclusive evidence. And that's being said more in major media outlets that's it's been debunked. There is no chemical balance theory. I can tell you about the confluence of historical factors that created it that makes a lot of sense, but the reality is most people who, if I'm I just spark up conversations with people in an Uber or Lyft, or as well as like my clients. Most people believe that theory,
Mhm.
that there's differences genetically that determine brain neurochemistry balances. And if you struggle with anxiety or depression, you have an inherent imbalance, kind of like hair color and eye color. It's what you are. And I think then also in the trauma informed movement, it's the beginning of me walking this new path was understanding trauma. I was working with high risk youth, like the most severely disabled youth in San Mateo County. And this was in the early 2000s. It was the heyday of this diagnosis of pediatric bipolar disorder, which was like so overdiagnosed and so overprescribed. My average kid that I was working with was on 2 to 3 medications, had 3 or 4 diagnoses. And this was, ADHD, bipolar disorder, oppositional defiant disorder. And then you would open their charts and you would see, you would read their case histories. So, sitting with like a 16-year-old or 18-year-old that entered the foster care system. This is like just a typical story, like, 3, 4, 5 years old, 7, 8 years old, really young, removed in the middle of the night because of a parent's abuse or violence in the home, for whatever reason, reaching a point in which, authorities were called in, and they go into a group home. And at 5 a.m, they're admitted into a group home. And then at 7 a.m, they get into a fight. Or day 3 there, they throw a chair, and then get medicated. And then, and then you read the story. And the thing that stood out to me was like, all of that makes sense.
Of course.
If I were 7 years old, yeah, and I just got removed, and I got removed from a violent place, right? And a lot of these medications, they also then have side effects that create new symptoms. And psychiatrists know this, and people who have been on medication know this, because it's so common. It's very common that you will use new medications, to second and third medications, to deal with side effects of the original ones.
Mm-hmm.
So this, like, these sequence of events that I think are all well-intentioned, trying to help people, but the lens itself, this sickness model, versus like really looking at most of the reactions people are having, make sense.
Mm-hmm.
It's just as often that I might say to somebody, if you didn't have this difficult, like if you weren't angry, if you weren't sad, I would be more concerned. But what's
Mm-hmm.
happening, we don't have the channels in which we usually complete our emotions, complete our stress response.
Mm-hmm.
We've narrowed in our society what emotions and to what degree to show emotions. So we grow up in families and homes and in a culture that imposes, rigid ideas on who we need to be. And so we carry these things around. There's a really great influence on me was Sebastian Unger's book Tribe, where he shows that we predominantly mental health services go down during times of crisis, because it's during times of crisis that we're pulled closer together and it makes sense. The problem is we've left as a society of being a trauma oriented society, that we understand bad things happen. And so there's these accumulations of emotions and stress that we carry in our lives, and we're being given the wrong message of what's going to be fulfilling also. So where we can build up more and more stress as we're trying to seek happiness, and through material ways that aren't bad, but they don't meet these other needs.
Mm-hmm.
So just like a plant has particular needs of soil, sun, water, we have different needs, and we're not getting those needs met.
It's really interesting that you say that you cited that research or observation that mental health seems to get better in societies during times of crisis. I mean, I know I'm just an N of one here, but anecdotally, at the beginning of the pandemic, my anxiety went way down. And I know that that was probably maybe the opposite for many people, but that sense of community, that sense of cohesion was very palpable to me.
There's a really great example that I like to use is something called pica. You might know pica. It's like severe iron deficiency, where a person has such severe iron deficiency that they start behaving really erratically, where you start to eat clay and garbage, and like you will eat anything in order to get iron, and you don't know that you're iron deficient. And I think that that's what it is like for human beings in modern life often, is that we're told that you don't need others and you don't need to feel your body and feelings, and you don't need to be in nature. But these experiences, that people were having when the pandemic first started, like, I can hear birds chirping, there's a quiet in my streets, and like, and we're more connected with each other. That's just kind of a return to like our baseline experiences, right?
Mhm.
But otherwise we're not getting that. So then we're speeding up. We're speeding up, trying to get some way to feel that aliveness. So we like we challenge ourselves intensely. Workaholism is maybe it's an accepted addiction that we have. Um, yeah.
I absolutely love the way that you're describing this. So, I mean, just to kind of reflect back, make sure I'm understanding correctly. But first of all, we're distracting ourselves from what's going on. And you mentioned just trying to excite ourselves and maybe get some sort of dopamine, hit or something like that off of what we're doing. But distracting ourselves from the symptoms that we're experiencing, which are in fact an appropriate response to what's happening.
Right.
And I love the way that you're framing that, saying that our symptoms make sense, like what we're going through makes sense, because that is empowering. It does give people a sense of like, oh, well, there's actually something that I could do about this versus just identifying with it and kind of fusing with that experience. Um, I know a lot of your work is focused on that, is focused on looking at kind of the contextual factors, external factors that are contributing to people's mental health, the community and larger systems. Can you talk about that a little bit? Just like how you just say a little bit more about how you see that, how you see context contributing to people's health.
Yeah. I mean, it starts with looking at the human being. I think simplifying it a little bit, like where the human being is way more complex than a house plant. But we study a house plant through what's called an ecological lens in terms of its health, that we don't look at human beings that way. Like that card you get when you buy a house plant tells you how much water, how much sun. That's an ecological approach. So that's how we study health in all organisms, except for human beings, where you investigate what are the conditions this organism evolved to thrive in, right? What's if you don't treat an orchid the same as you do a fern, right? You don't water it the same, different kind of sun, and you understand what the relationships with its environment it evolved to need. Human beings, we don't do that. That's a positive health approach versus we have a sickness approach. So the other part of like how to look at this of this ecological is what I call it, is the ecological trauma informed lens, because it's trauma informed, but it's understanding that we naturally heal and thrive when we look at it from that positive lens of what do we need to empower our natural capacities. Just like winter comes and the leaves get torn down. That's what fall is, right? The leaves are changing and dying and decaying and breaking down, but that's part of a cycle. That's actually how the plant grows. Like the spring that comes after the winter, that growth happens in part because of the decay that happens in fall and winter. Well, that's what deeper resilience comes out through struggle. So these are all ecological ways of looking at things, and the research like supports the outcomes based on that lens. So the other, so it's looking at the story through that lens. It's about like how, if you take like a seashell or a leaf, that each one is completely different, right? No two seashells look exactly alike. But they're pretty much the same in terms of their basic makeup, right? And so human beings, we because of our mental capacity, because of the storytelling part of our brain, I can't, this idea like you can never know another person completely, like, because it's so unique. And that's why I have to be maybe in therapy with you for 2 years, 3 years to really unpack the exact details of my story in the way that I would like to say them. That's all the mental part of my head. But my basic makeup, we're the same. We grieve over the same things. We hurt over the same things. It's a human reaction. If dad is mean to mom, or if dad is scary to me, if these things, if mom, if these things happen, we have basically the same reactions to react to grief, trauma, and we have the same basic needs. So what I think is possible, that we do in our clinic and what we're trying to put out in our nonprofit, is that we can basically tell that story to people and give them a roadmap to heal. I can sit with somebody and they can say to me, I don't care. I don't need community. I don't need relationships. If you have, it's very rare that you would be somebody who I wouldn't be able to turn to and say, I don't think that's true. I think you do need community. I think you do need purpose in your life. We're wired to need, like, to feel that we are a part of something and that we need something to be a part of, in which we have a role, that we have a purpose in our lives.
Mm-hmm.
We need to be able to regulate our own nervous systems. That's part of becoming an adult, just like a plant evolves to, it's designed to learn how to use the sun, use the soil, use the water in order to grow. We also are designed to seek out self-empowerment. I think that when I say to somebody, I know you can get better, I'm tapping into something that's deeply part of their biological ancestry, wiring, is actually to get excited about achieving something.
Mm-hmm. It's almost as if, I'm just having the image of like, all the tools, all the resources that we need to heal are inherently inside of us. And our nervous system wants to heal, but it's almost as if we need to just be empowered enough to kind of say yes to that, or to kind of hit that button to allow those processes to naturally take place.
Exactly.
And could you say a little bit more about like how people do that? Is it just a sense of saying, yes, I'm on this journey of empowerment and I'm going to take my health into my own hands? What are some other ways that we can allow that inherent natural process to do its thing? If you look at indigenous, like more traditional ways of healing, things like the sweat lodge or vision quest, there's a time in our lives that but if you've been through any crisis, really, if you've been through any crisis, if you ever had any situation in which you were truly scared that you weren't going to make it, it's a moment in which you know yourself more than ever. It's like that, I thought I was going to die and my life flashed before my eyes.
We're so disconnected from ourselves that we can block out pieces of what's happening, just like you can drive home and not notice how you stopped at the last 3 red lights. We can be so disconnected and disassociated. So the most important thing is like actually seeing the story, seeing the truth of like, why am I here? And what really helps is actually for us is like that we work with people that really have reached a point of crisis. Like when you said earlier that your symptoms are actually your health emerging, they're actually what makes sense. It's also that crisis is part of, the experience of growth, and seeing that it's actually a time in which you are able to piece together what happened. And so helping people piece together the story at the outset, where they can see that the reason why they're struggling comes from the things that are most deeply important to them. The things that we grieve or the things that we are traumatized by are the things that we cherish. The choices that we make are expressions of like what's meaningful and important in our lives. So piecing that together for people in a way that's accurate to what happened, but also meaningful and inspiring, I find that's the most important thing I can do with people, is like, and we do that at the assessment, is like to give people a way to see the whole thing, that which includes your future. Like, what are they trying to achieve in life? Like what purpose do they feel they have? Where do they derive meaning in their lives? Another, I think the most important way you can tap into motivation, if you're talking about motivation, is how we impact each other. So we also, it's like part of what it is to be human is that we derive meaning through how we impact other people. Mm-hmm. There actually is like data on this around health outcomes and the impact of purpose and meaning in our lives, and that we have purpose and meaning through how we impact something beyond myself. And so like seeing change in terms of how it will actualize that need we have inside ourselves. Am I going to become a better father? Am I going to be a better husband? Am I going to be a better brother? Am I going to, what is this going to mean if I face this hardship through a lens of being empowered?
Yeah. Doing something because it aligns with people's core values, with who they are, what they want out of life. And that seems like the most motivating thing for us to go through challenge and difficulty.
Yeah. And so lining up someone's values, but when you look at people's core values, they're rarely self. I'd like to think like the reason why there's so many self-help books is because we don't really succeed when it's just about myself, but we get really driven by something bigger, something more meaningful. Like when you look at people's core values, when you spend time working with people on their values, it usually comes down to like, family, community, special moments with people I love. It's something where you need other people. And that's what drives us, is like, there's something meaningful happening bigger than me.
It's really interesting to think that that's part of our hardware, like almost that like by design, we're designed to go through difficulty, to experience challenge and suffering in our life almost for other people. Like it's it makes, like kind of religious and spiritual frameworks, it really validates them. It's like, oh yeah, like my suffering makes sense. My suffering is for a higher purpose. So it's, yeah, very interesting from that angle.
Yeah, no, the backbone to like my thinking as a whole was, there's a guy, Aaron Antonovsky. He was an Israeli medical sociologist, and he coined the term salutogenesis, which is health promotion. So anybody who's gone through medical school knows that the study of medicine in Western society is pathogenesis. Your first class, one of your first classes is pathology, which is like learning what happens when people get sick. And what he wanted to do is he wanted to understand, why are there such different health outcomes for Holocaust survivors? There are Holocaust survivors that seem to actually thrive, whereas others do worse. So there's this divergence where either they're doing worse than the average population or they're thriving. And what he came to in terms of his study was that the individuals and communities that seem to actually thrive in the face of hardship, they imparted to the culture imparted what's called a sense of coherence. And that sense of coherence means that when you go through something, you believe that ultimately it's understandable what I'm going through, it's manageable, and then most importantly, that it's meaningful that I face this. So that lens of going through hardship, to me, what that is that's the art of storytelling. That really, medicine, before we had surgery and tech and procedures, before we started to treat people, most of human history, all we had was telling each other stories, sitting around the fire, the elders telling heroic stories, or story of being patient, or the need to be humble, or the need to have temperance, or these different virtues that we have to cultivate in order to face life as well as possible. So these wisdom traditions, that tell accurate, meaningful, and inspiring stories, I think that's like the most impactful thing we do in terms of health. And we have the biggest medical industry in the world. We have very low success in terms of chronic health conditions that are lifestyle related, that have to do with the choices we make day to day. And I think it has to do with the story we tell, the stories we're telling about human fulfillment. Like, what are the things that actually lead to a better life versus a worse life?
Mm-hmm. So the story is the medicine in a way.
Yeah. And that's why the story, the first meeting being a chance to tell a person's story through this new lens, it's like the training we do to teach providers how to do this. It's a lot of it is the art of storytelling.
Mm-hmm.
It's understanding that what you're doing is you're telling a story. When I went through all of my training in Western psychiatry, and I was living somewhere else, and I came back to Los Angeles for a period of time to work in my own community. And I grew up in a very tight Iranian community. So Iranians are very family oriented. And a friend of mine referred his nephew, who was like 15, had anxiety. And I did therapy with him. And I got to a certain point where it was clear that his mom and dad having financial issues was really worrying him a lot. And I was trained to, at that point, make an interpretation where I said something to the effect of, I think that your anxiety is because of your parents. You're anxious about your parents. And in that moment, it was interesting because on my side of the couch or whatever, I was saying what's wrong. And I was making an interpretation. I knew the word in my mind was that he's enmeshed. That's a psychological term that I think comes out of psychoanalysis and psychodynamic theories around how parents and children can be enmeshed, which means that they start to feel each other's feelings and they're playing off of each other's emotions. But what was interesting, he reacted in a way that I had been away from the Iranian community for like a decade. Now, I grew up knowing that our values were like, you care deeply about each other. Like, yeah, everyone's like really tight in that way. Like you're a deep tribe in that way. So and his reaction was like, no, like, yeah, like that's right. Like, and he was responding more or less like valor, like that's what I'm proud of. Like, you know, in Farsi, what Iranians speak, when you want to say to somebody about, when you speak about somebody and you want to say there's somebody of like really good character, which means that they look out for other people. They have that understanding and of what it is to be human. The word you use is human. You say they're very human.
Hmm.
And anyway, so it's like that story I'm telling it's that we're always telling a story. Like if someone comes in and they have anxiety, and I say to them, you have generalized anxiety disorder, and that's my feedback. You have generalized anxiety disorder. And
Mhm.
they're living in a culture that thinks like these, if you have a disorder, it means you have a chemical imbalance, which means it's genetic, which means it's like my hair color, it's what I have to live with. They're coming in the door already feeling over like I have a problem, I'm struggling with something, right? That's why they're there. I think it's like now I have another problem. Not only am I worried about the thing that was making me worried, but now I find out I actually have a disorder, like I have cancer.
Mhm.
So we're storytelling all the time. We're always telling a story. We're transmitting values. We're transmitting meaning in all the communications we make. And so, you know, when you look at like the placebo response data, like that shows that high degree to which we can actually, because of belief, have really different outcomes. I think that storytelling is something that we don't realize that's what we're doing. And if we realize it, we actually can tap into the formulas in which we can that are leading to that placebo response. We in Western medicine, we view placebo as this weird thing that happens in some people, right? And there is really great research now that's starting to show what's actually happening with placebo, but it's basically like we feel like there's something meaningful happening. I feel hope, I believe in something, which means that if I stopped, you know, doing my morning, you know, exercise, or I stopped, you know, I started choosing unhealthy things because I was feeling hopeless, or I stopped calling certain people and making plans because I felt like, but instead I start to make those decisions where I, you know, I'll take that walk, I'll eat better, I'll go and I'll see my friend today because I feel like something positive is happening.
Mhm.
And it's actually those things that we start to do that we start to feel better because we start to give ourselves the positive health promoting things that we evolve to need.
Mhm. Someone's listening now and they're struggling with some part of their illness, physical or mental. How would you recommend that they start to work with that internal story? And I know it's hard not, actually working in the room with someone and everyone's different in their own way, but are there some general things that people can start with to start getting a sense of empowerment and start changing the narrative that's happening inside of their head around their health?
To their own story. Um, yeah, I mean, I think it starts with going back and looking, you know, at are there things in my life that I didn't deal with, that I'm holding inside, that I carry inside? Um, are there things that I are unresolved in me? And the first thing then to ask after that is like, where do I hold it? Like we hold
Mm.
these in our bodies. You know, we hold these things in our shoulders, in our stomachs, in our hearts. We also carry them in our lifestyle choices. You know,
Mm.
like we all know deep down certain patterns of behavior that we have, like certain ways we avoid certain things we do a little bit compulsively. Well, those are all trying to manage something that we are not complete with. Um, this is why, you know, meditation can be helpful because we devote time to be still and see and be able to observe more objectively and with more openness just our patterns. um, so you can go about it, you know, a lot of different ways, but it's a decision to start to pay attention to your health, as something. I think empowerment, self-empowerment, the basis of Antonovsky's work was to say what most wisdom traditions say, which is life is suffering, like life, that health is not, we have it. What he was talking about is that we have this belief in the West that health is the norm and that disease is actually the betrayal. It's like that's when something went wrong. When in reality, health is actually this accomplishment. It's the natural state of physics, of life, is actually breakdown. It's the
Yeah.
second law of entropy. Physics is entropy. And so what he was saying is, what is this life force? What is this force of health that keeps repairing, that keeps growing, despite the natural tendency for things to break down? I think that if you get that idea, it's pretty like taken for granted that you think about things the other way. And when you really take that idea in, it's like, to me, it's such a big light bulb moment, because it's like, right, that's actually totally true. Like, why are we healthy at all? It's because there's this force inside us that is striving for something, that's trying to keep us together, that's like sticking, holding together and growing.
Mm-hmm.
So I think feeling that, I think like knowing that's the story of like what it is to be human, what it is to be alive, is like, when I sit with somebody who's very, feels like, yeah, I mean, there's just, I think that belief is what drives me, is like to actually pan out and kind of see the reality a little bit more, that you can get lost in modern life, because there's just so much distraction. And also the focus we're being given is, how can I personally fulfill myself materially? And that's going to be the end goal. And so we're kind of in a maze where we don't know we're lost sometimes. We just,
Mm-hmm.
and that's when you feel like life is that hamster wheel where you're working really hard, but you don't feel really connected, uh, because it's that life force that you're not connected to.
So much good stuff there. Thank you for that.
Yeah.
I wanted to ask you about meaning and purpose kind of on a macro level as well. Is there a lack of meaning and purpose in our society, and where are we seeing that showing up? I have something specific in mind, but I just want to see kind of what you do with the question first.
My reaction to that is, we are drowning in purpose and meaning. If you look around, there's so many problems to solve. That's where all the purpose and meaning is in like solving problems. We are, I mean, I think kids shoot up schools because of meaninglessness.
Yeah, that's exactly what I was thinking. And earlier today, it was just looking at my phone, and there was another shooting at a university, I believe, in Virginia.
Yeah. I think it's emptiness. I think it's a feeling of emptiness that, you know, that despair, it's an act of rage against that. I think that there's a lot of things to be purposeful and meaningful about it. And I think a lot of people feel purpose and meaning in their lives when you're on track to do what you care about, and you feel like you're making an impact in some real way. By which I mean, like, I'll share my own experience of like the opposite is like, I can come on a podcast and say things that inspire people, but be a jerk tonight at dinner, and like not really have an impact on people in my real life. Like, I think that we need to feel impactful in a real way. We're there's so much persona and display and performativeness. Like, like clients just talk about what's happening socially for them is like what they experience online. Like I often am like, wait, what, how did you find that out? Oh, she posted it. I was like, oh, it's just very weird the way we're living right now. You know, we're going through a really weird transition. So there's a lot of disconnection, and we are, you know, our society really invented the idea of liberating the individual, and that the individual liberty, but happiness is not sufficient. You know, that's a temporary feeling versus like a deeper feelings of contentment and purpose, you know. And so we need happiness, we need play, we need a lot of different things, but we're lacking in more deep, meaningful experiences, because they're harder to come by, because they happen in real life experiences. You know, they happen in moments of physical presence with each other, you know, that are actually just happening less and less. I mean, I mean, we live very, very isolated here compared to how most of humans lived for how we evolved. Uh,
I want to
yeah.
come back to what you were saying a little bit earlier, about salutogenesis. I hope I'm getting the word
Yeah.
right. But I think this is helpful. You said three words, and they really stuck out in my mind. And I feel like they provide a helpful framework for people in thinking about their life and their suffering and their health. But if I'm remembering correctly, I think it was one of them was a sense of purpose. One of them was a sense of, or like this, my suffering has purpose. My suffering is manageable, I think was the second one.
Understandable. There's a reason. There is some reason why. It's, I mean, it's understandable. If I work, I can come to understand this better. Number two, that in some way it's manageable. There's a skill or resource that I could acquire, learning some new breathing technique to cope with my panic, or learning, you know, I can reach out to a friend instead of buying, you know, that drug. There's a skill that I can acquire. And then the third is that for me to figure this out and try and learn new things, it'll matter. It's meaningful
Mm-hmm.
for me to face this. It
Mm-hmm.
will act in some way that matters.
Mm-hmm. Thank you for kind of playing that back. And I think that's a really nice theme for our conversation today, is that people's suffering matters. There's purpose in it, and that we can have a sense of empowerment around that.
Yeah. Yeah. And I just like to go back to that idea of that's the art of storytelling. That's what all stories are doing. They're telling stories about individuals going through life experiences. The basic thing they're telling in the meta communication is like that there's sequences of events to things that are understandable. And that's the starting point of wisdom, is how you connect the dots. Like the difference between knowledge and wisdom is understanding the meaning, like what really means. You know, you could have a ton of data, but understanding how it really matters. The hero or whatever characters, they go through experiences in which they have to figure out new ways of doing things, right? No story starts with like, you know, the person's the same at the end as they were in the beginning, unless it's a story about someone who refused to change, you know, like, because life makes you change, makes you figure out what you have to do. And then the last is like that it's a meaningful story.
I absolutely love that like the difference between like it's just data or meaning and not meaning is connecting the dots and telling a story around something.
We have this ecological trauma informed lens, this ecological way of generating health, where like, what do you need to thrive, and then to create, just like, you know, I'm looking at the house plant as I talk about it. It's like, where am I going to put you, and when am I going to water you, and what's my system? if we did that for ourselves, like that would be, that's what we don't do in our healthcare system. And we have plenty of data. We don't have the maturity to use it properly. You know, I work with, it's like I'm thinking about clients I've had who are like working at top labs in top universities. And they're saying, yeah, you know, everything's being driven by, we need to publish data that's sexy and, you know, got to get our department more money. It's like everything is being driven by the wrong values sometimes. And we need elders, because it's the elders that tell those good stories, because the elders, that's the role they play. We're struggling to produce adults in our society, and you can't produce adults unless you have elders, and we don't value elders either. Elderhood, which is not about being old, but about having acquired enough life experience and integrity to really understand like what matters, so that you hold that space in your community.
Mm-hmm. Mm-hmm. Well, I'm really hoping that we can see more of a shift to this community focus. I know that you're out there doing your work, doing that work. You have a nonprofit. Did you want to just say a little bit about the nonprofit organization?
Yeah, the nonprofit is called Lameda Project. Um, I had a place called Lameda Institute a number of years ago that was this concept for a healthcare center that had a yoga and meditation studio. It had a kitchen. It had classes as well as practitioners, and it succeeded in getting. We got invited to a major foster care mental health agency called McKinley Child Center in San Dimas in Southern California to implement that model. And it led us to say, hey, you know, I think we can actually export this approach to non-mental health organizations, even like that, really understanding this ecological lens means promoting. It's like that how to care for the plant card. If we can promote that idea, that there's basic formula for how we thrive, and to start to change values, and to see how the communities we live in and the organizations we work in are places in which we can generate health through particular practices. So we're exporting those. It's like a specific methodology that any organization, any corporation can implement in terms of how to operate your culture that produces the best creative productivity, but also we see ourselves as co-creating health together by how we hold each other accountable and support each other to be self-empowered. And it's like, it's a formula for generating mental health naturally.
Awesome. Wonderful. Well, we covered so many rich pieces of information today. And so I so appreciate you being here. Is there anything else that we haven't covered that you just wanted to share, add to the conversation?
No, I think you gave me a chance to say the things I want to say the most. You know, it's like, if people, I think we should see ourselves as being able to recover. Most people I work with are off medication, not years later either, and doing really well. And you know, we're 1 out of 5 people in this country is on a psychoactive medication. So I hope this idea spreads and we do better. Thank you.
Thank you for the work that you do. Where can people learn more about you, your work, and the nonprofit organization?
Yeah, the clinic in Los Angeles and also in Northern California is Hope Psychiatry, HOPE psychiatry.com. And Lameda Project, LAMAIDA project.org, Lameda Project.
Awesome. Dr. Naim, thank you so much for being here.
Thank you. Thanks, Matthew. Thanks for having me.